Welcome to The Explainer. Today we're pulling back the curtain on the intricate music of the female reproductive system. It's this incredibly complex performance that happens inside the body every single month, and a lot of the time we don't even think about it. So let's break down exactly how this hormonal orchestra works, note by note.
So let's just start with the biggest question of all. Who, or what, is actually in charge here? What's kicking this whole process off, keeping it on track, and then bringing it to a close every single month?
Well, the best way to think about it is, like an orchestra, a hormonal orchestra, to be specific. And just like any great orchestra, it needs conductors to lead the whole performance. And there are two main conductors we really need to meet, because they call all the shots.
So let's meet our two key players. Seriously, understanding what these two hormones do is the foundation for pretty much everything else we're going to talk about. Okay, so here they are. On one side, you have estrogen. I want you to think of estrogen as the builder. Its main job is to build up the uterine lining, making it thick and ready. Then on the other side, you have progesterone. It's the maintainer. So after estrogen does all the building, progesterone comes in to hold everything steady and make it a perfect, welcoming environment for a potential pregnancy. They have totally different jobs, but both are absolutely essential.
All right, so now that we've met our conductors, let's actually watch them in action. Let's see how they work together to create the perfect symphony of a healthy menstrual cycle, moving from one phase to the next.
The whole performance kicks off with the follicular phase. This is the first half of your cycle, and estrogen is the undisputed star of the show. It's what drives a follicle in the ovary, which is just a little sac with an egg inside, to grow and mature. So think of this as the big prep period before the main event.
Then, after ovulation, we enter the luteal phase. That empty follicle, it completely transforms into something called the corpus luteum, which is basically a temporary progesterone factory. Its whole purpose is to just pump out progesterone. And what's really amazing is that this phase is almost always 14 days long. It's incredibly consistent because that corpus luteum has a set lifespan.
And this graph, this is basically the sheet music for the entire performance. Let's walk through it real quick. You see estrogen, that's A, rising and rising during that first phase. That big spike in estrogen is what triggers a surge of another hormone, LH, which you can see at C. That LH surge is the direct signal for ovulation to happen. And then what happens right after? Look at D, progesterone rises and takes over for the second half. It's just a perfect, beautifully timed handoff.
But, what happens when the orchestra is out of tune? Sometimes the rhythm gets disrupted, and that leads to what you could call hormonal dissonance. Let's explore what that can look and feel like.
Sometimes the body gives us these visible clues on the outside that something's off on the inside. This skin condition right here, it's called acanthosis nigricans, and it's often a sign of insulin resistance. And when your body's insulin system isn't working right, it can throw other hormones completely out of whack, which is a key part of a really common condition, polycystic ovarian syndrome, or PCOS.
So when it comes to diagnosing PCOS, it's not just one single thing. Doctors use what's called the Rotterdam criteria, and here's the crucial part. A diagnosis requires meeting at least 2 out of these 3 conditions. It could be high androgens and irregular periods, or irregular periods and polycystic ovaries on an ultrasound. You get the idea. 2 out of 3.
And this slide gives us a really clear look at what polycystic actually means. And it's not what most people think. It isn't about having large, painful cysts. If you look at that ultrasound, all those little dark circles, those are immature follicles. The term comes from the fact that there are just many of them, and they're often arranged in what doctors call a string of pearls or a necklace pattern around the edge of the ovary.
Now for another really common form of dissonance, one that many people are way too familiar with, dysmenorrhea. That's just the medical name for painful periods, and it's not some random discomfort. There is a clear biological process that causes it.
It is literally a chemical chain of events. So remember progesterone, our maintainer? Well, just before a period is supposed to start, its levels totally plummet. That sudden drop causes the blood vessels in the uterus to constrict, and that in turn releases chemicals called prostaglandins. And these prostaglandins are powerful. They're what triggered the uterine contractions that we feel as cramping and pain. It's a direct cascade.
Okay, so now let's look at the orchestra's final act. Over time, the symphony naturally changes, of course. It leads to the final crescendo and then decrescendo of the reproductive years, which is menopause.
51. That one number represents the average age of menopause all around the world. And what it means clinically is 1 full year without a period. It's the signal that the orchestra's regular monthly performances have come to a permanent end.
And this table right here, this really shows why this transition matters so much. Estrogen isn't just about reproduction. It's a hugely protective hormone for the entire body. Before menopause, it helps protect heart health and maintain bone density. But after menopause, when those estrogen levels fall, the risks for things like coronary artery disease and osteoporosis go way up, not to mention everything from body temperature to vaginal health.
And let's quickly talk about one of the most famous symptoms of this change: hot flashes. They are a direct result of that drop in estrogen. See, that decline disrupts the balance of key chemical messengers in the brain, messengers that also happen to regulate your body's internal thermostat. So it's basically a neurological response to a hormonal change.
So, at the end of the day, the menstrual cycle is so much more than just a monthly event. It's a vital sign. It's the music of your hormones playing out in real time. And understanding its rhythm, who the conductors are, and the signs of dissonance, that's really the first step to advocating for your own health. So, we'll leave you with this question. Are you listening to what your body is trying to tell you?